Here at the Melanin Initiative, we simplify medical information into language you can understand. We create a safe space to ask your questions and share a nursing perspective. By the end of this episode, you'll know the real truth behind GLP-1 medications, what they are, who they're really for, and what no one's telling you. Today's guest is our in-house endocrinology expert, Dr. Peggy Amoa Koian. She's someone who truly understands how these medications impact our bodies, our hormones, and our futures. I had to welcome her back to the show for a second time to answer your questions and get you the clarity you've been looking for. If you're new here, welcome to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner and one of your co-hosts here at the Melanin Initiative, along with Alicia and Geraldine, who send their love in their absence. We're a health literacy podcast. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and then to use it, to manage your health and advocate for others. We have two missions here. One is to promote that health literacy, both amongst the public and our peers. The second is to elevate the expertise of nurses, bring awareness to all the diverse career opportunities in healthcare, and to share with our peers all the ways that they can leverage their expertise as clinicians and entrepreneurs. If you haven't already, this is your chance to subscribe. Leave us a thumbs up and a comment. Share this information with your friends. And if you're listening on Apple or Spotify, please give us a 5-star review. When you do those things, it helps the algorithm see that this information is important, so that when people like you look for topics like this, we show up higher in their search results. Remember, this show is for educational purposes only. The opinions expressed here are opinions alone. They're not a representation of any of our affiliations. If you think you might be experiencing a medical emergency, you should contact your medical provider. And if you think you might be having a physical emergency, you can call 911. If you or someone you know might be having a mental health emergency, you can call 988 or text 741-741. Now, when we talk about leaders in medicine who are not only brilliant at what they do, but deeply committed to their patients, their community, and the next generation, this woman's name stays at the top of that list. Dr. Peggy is a board-certified endocrinologist with a heart for patient education and a sharp mind to match. She's completed her fellowship at the University of Virginia and currently serves communities across Northern Virginia. She was just named Northern Virginia Magazine Top Doc for 2025. And trust me, when you hear her speak, you'll understand why. She was born in Washington, D.C., raised in Ghana, and now blazing trails right here in Virginia. Her career has been fueled by purpose, passion, and a determination to make sure patients get more than prescriptions. They get dignity, education, and care they can trust. Whether it's managing diabetes, navigating complex hormone disorders, or connecting the myths floating around social media, she brings clarity, compassion, and evidence-based truth to every room she walks into. And when she's not saving lives, she's baking dairy-free chocolate chip cookies and scouting her next skydiving adventure. It's my honor to welcome her back for the second time to the Melanin Initiative. Welcome back, Dr. Peggy.
Thank you so much, Dr. Madison. I love your introductions all the time, so thank you for having me once again. I'm excited to be here.
Thank you for coming back to the show. You already participated in our Icebreaker the last time, so this time we just have two questions for you. The first one is, what do you love about endocrinology?
I love endocrinology. Everything about it. I think it's a beautiful specialty, keeps me on my toes. It helps me think all the time, and I've met all sorts of patients from all walks of life. And, you learn a lot on the job, but you also grow as well. And it's just beautiful figuring things out and making a huge impact in people's lives. So, yes, definitely, it's a specialty I love.
And then what has drawn you to skydiving?
So I haven't done it yet, but I hope to do it sometime soon. I've done the paragliding and all that kind of stuff, but yeah, I think I love adventure, so I think this is something I want to try. I haven't done it, but I hope to do it soon.
Adventure and the soft life. Great.
Agreed. Adventure and soft life. Yep.
Well, you deserve it, and we hope that it's everything you imagine and more. Actually, I hope it changes the trajectory of your life, and the plans that you have today get wiped away by dreams that are much bigger than you could ever imagine.
Oh, thank you. I love that. Very,
Yeah.
very beautifully said. Yes.
Okay, so let's talk about these myths when it comes to GLP-1s. This is be our fourth time talking about weight loss medications, and it's been a very popular topic. Alicia and Geraldine have been kind enough to share their own personal journey when it comes to taking them, and we'll put the links to those in the description box. So let me talk to you about Steve. He's 36. He's navigating prediabetes, juggling work life, and trying to take care of his health. He's seen the Ozempic reels on TikTok. He's heard the celebrities, and now he's wondering, is this for him? Is it safe for people like us? And what aren't they telling him? So, Dr. Peggy, if Steve was sitting right here with us, what would you want him to know about GLP-1 medications?
So, Steve, just so you know, it's not only for celebrities, okay? y- I guess you're a celebrity in your own right, but yes, this is just not for them. This is for people who are having difficulty with their weight, people with certain medical conditions like diabetes, heart disease, kidney disease. So, yes, and they're safe medications overall. So, Steve, yes, he could be a candidate for these medications, and it's not just for certain people.
And for Black and brown men like Steve, why should they be part of this conversation early and not wait until everyone else has tested it out?
So, yes, I think these medications are great medications with good data to support their outcomes, right? They've improved people's quality of lives, reduced risk of death from a cardiovascular standpoint. They improve diabetes, it helps with your weight, has kidney benefit as well, of course, depending on which one. So I don't think we should wait till other people have tried it for years and then say, oh, well, let's wait and see what happens, that they don't develop any cancers and we'll get on board. The good thing is some of these have been around for years. We haven't seen any crazy things happen. So they are safe when used correctly. So I think Steve should get on board. Of course, if he doesn't have any reasons not to, if he doesn't have any medical condition that doesn't allow him to, I think Steve, keep an open mind. Let's give it a try. And I think it'll make a difference.
All right, let's talk about the 5 things people might not know about GLP-1s. First one, Steve, listen up. Let's be clear. Let's clear this up real quick. These medications are just for weight loss. True or false, Dr. Peggy?
So that's false, right? Yes, they're good for weight, but we use them for quite a number of medical conditions like diabetes, which is one of my favorite things to treat. So diabetes is definitely one of them. Cardiovascular diseases, it has been shown that Ozempic, for instance, has good cardiovascular outcomes. So that's a great medication to use. Now we're seeing that kidney disease, to slow down the progression of kidney disease, these medications have been helpful. So, yes, they're good for weight, but they do have other reasons, right? So, another off label uses like PCOS, insulin resistance, these medications have been shown to improve these. So, yes, they are good medications and they're not just for weight.
Now, if you've heard that anybody can just get these medications without labs or screening, Dr. Peggy's going to let us know. What should Steve make sure his provider checks before he even thinks about starting something like this?
So yes, Steve, ideally we want you to get baseline blood work done, okay? We want to see what your kidney function is like, what your liver enzymes look like, your A1C, which screens for diabetes. Those are some of the tests that we want to do because if you have impaired kidney function, let's say some of these medications you want to be cautious with if someone has impaired kidney function, you want to be a bit more cautious with some of these medications. So definitely some baseline blood work, okay, before you try any of these medications. At least talk to your doctor, your provider, and ask, hey, at least let's get some labs done. And then it'll help us know the outcomes down the line. Oh, things have improved 3 to 6 months down the line. It will be good to have something to compare to. So, yes.
Okay, Steve's heard that the minute he stops the medication, if he goes to on it, that all his weight's going to come back. Should he be worried about that?
So I understand Steve's concerns. These medications, they work by making you feel like you're full, you don't want to eat as much, you see the food, and it helps quiet some of this food noise. So they're helpful in that regard. People tend to lose a lot of weight. But if you stop the medication and you do not have the same discipline or those practices that you were doing before, like, okay, hey, I know that I shouldn't be eating the whole pie. If you go back to those habits, then definitely you're going to gain all the weight back and even more. um if you're able to stick to some of these habits, then yes, you may not lose more, but you can maintain. If you're exercising, this should help too. So some people do gain a little bit of weight after that, but you have to remember to stick to the practices that have helped you: the portion control, the avoidance of late night eating, the physical activity. If you're doing that while you're on the medication and you continue to do that off the medication, you shouldn't gain your 50 or 100 pounds back just because you stopped the medication.
Yeah, and Alicia and Geraldine, some of the things you're bringing up, they talked about when they shared their experience,
Okay,
including
good.
this next big question about diet and exercise. Now, they are doing those things,
Very
but
good.
Steve has heard that it doesn't matter anymore. And a lot of
Mm-mm.
people, when they hear other people, they're like, oh, you're taking the easy way out because you're just taking a medication. Look, Steve's a busy man. How can he start to plan lifestyle changes into this picture?
So, Steve, lifestyle is key. Yes, these are great medications, they'll help you lose weight, but lifestyle modification is the cornerstone of all this. So yes, we have to eat better. Okay, so you have to watch what you're eating. You cannot just have your Captain Crunch for breakfast or eat 10 p.m., go to bed at 10:30 and expect to also lose significant amount of weight. So yes, these are great, they will help you lose weight, but you want to put in the effort so that it makes the difference from losing 5 pounds versus 50, right? If you do put in the effort, you will get more out of these medications. And of course, you'll feel better overall. And we know that physical activity and eating well is good for your overall well being. We're not just talking about, oh, you want to lose weight, but you want to be healthy. So, Steve, we have to eat better. Okay. So, you want to cut out all the, I mean, you're human, you have to eat, but we can't eat it. One of my patients, I talked to a lot of people and he told me he eats um I think he does McDonald's for breakfast, KFC for lunch, Golden Corral for dinner, right? And every day this is it, right? So we cannot do that and expect to be on Ozempic and then lose 50 pounds by doing all these things. So we want to be careful with that.
Okay, so you said it so this is now you brought up a question for me. So you said it cuts back the appetite, and then we've heard this. Even Alicia and Geraldine talked about that. So it would sound like, right, if I don't have a Dr. Peggy in my corner,
Mhm.
that I can still go to McDonald's, I can still go to get chicken, I can still go to the Golden Corral because I'm just going to eat a little bit less. You guys always tell me eat in moderation. Look, this is moderation.
So true, true. I mean, the good thing is they make you feel like you're full, right? So maybe if you would have had two plates, you might end up with one or even half of one. But what is on that plate, right? Because I can go to McDonald's and then some people would say, okay, hey, I'll just get maybe some chicken nuggets and fries. But if I'm gonna drink my Sprite, my regular Sprite, I am eating the fries. Yes, it's not much, but I'm still eating junk food, right? Then we're not gonna get the full benefit. Your cholesterols are gonna go up too, right? So, yes, smaller quantities, but what goes into that smaller quantity? What kind of food is it, right? So you still want to go for the healthier options. Yes, you might eat less, but if I'm eating, oh, I had the mashed potatoes and a Coke or whatever, we're still not gonna get the full benefit of the medication.
Yeah, and if I hear you right, because you're eating smaller, it becomes even that much more important that what you're eating is nutritious.
Exactly. Yes, yes. You don't want to be slim but deficient in all the essential nutrients you need.
Yeah. Okay. For our last myth, for our listeners thinking this is you, and you brought it up, you said it's not only for the rich and famous. So, what are the real options when it comes to accessing these medications, especially for people like Steve?
So, Steve, the good thing is insurance is covering a lot of these medications these days. Of course, sometimes you might not get the one you want, right? Some people say, hey, I want Mount Jaro, but your insurance is covering Ozempic. So, with that, insurance tends to kind of control the narrative a little bit more with regards to what they will cover. The good thing is they are covering these meds much more now. Some people are having to pay $35 for a month, or some even 3 months supply. So that's helpful. Without insurance, though, some of the companies do have copay cards or coupons you can get by going online, filling a form, and you can get it for a much discounted price. Like Manjaro would be maybe $25 a month. So there are options there. Some people have gone through medical clinics like spas where they're paying out of pocket. Those tend to get expensive, but if you have the means, right, you can pay $300 for a month or something, and your insurance is not covering, and you feel, hey, I can afford 300 or 250, that might be an option. Of course, you want to be careful with what you're getting because not everyone is giving you what they say they're giving you. So just be cautious, do your research before just getting it from anyone because, hey, I want to lose weight. Know what you're getting yourself into. Welcome to Premier Endocrine and Wellness Clinic, a new way of endocrine care. My name is Dr. Peggy Amwakuhene. I'm a board-certified internist and endocrinologist. I am the founder and CEO of Premier Endocrine and Wellness Clinic, and I serve patients in Virginia, DC, Maryland, and beyond. So which conditions do I manage? Apart from the usual diabetes, which could be type 1 or type 2 or diabetes in pregnancy, I also deal with thyroid-related disorders, whether you have an underactive thyroid, overactive thyroid, you have thyroid nodules, or even thyroid cancer. I treat those as well. The other things I deal with, PCOS, people who have bone-related issues like osteoporosis, adrenal-related issues like low cortisol or too much cortisol. These are things I specialize in. So why choose Premier Endocrine and Wellness Clinic? This is currently a virtual practice, so you can receive care from the comfort of your home. We're currently not a network with insurance, but rates are affordable and it will not break the bank. There are no hidden fees and there are no membership fees. To make your appointment, follow the link below.
Yeah, actually, Alicia, because she fell into the pre-diabetic range, her insurance is covering it.
Right.
Plus, her employer made her participate like in a kind of a
Yes.
accountability group,
Yep.
so that
Yep.
that helped. But Geraldine is the other example you provided. She didn't meet those qualifications, so she went to the med spa and she paid for the year.
Okay, good. Yes. Yes.
So this whole time we've been talking about Steve, and we didn't even mention that he has an advocate with him. His
Okay, great.
wife, Aisha, she watches the Melanin Initiative, and she knows, they both know, well, she knows, and she told him how important it is to have an advocate with you. So she has tagged along, and she's just sitting there quietly listening to you tell him all this stuff. And now you've piqued her interest. You kind of, especially when you talked about PCOS earlier. So she has PCOS and insulin resistance. She wants to know if these medications can work for that also, in addition to the weight management.
Yes. So we've seen that these medications have been pretty successful with PCOS. Of course, they're not FDA approved for that. So if your endocrinologist or your primary care physician or provider writes Ozempic for PCOS, it might not be covered because it's not approved for that label. We do know that they do work. Yes, they will help you lose weight, but people tend to have regular periods. They say they have more energy, they can do more, and they feel overall much better on these medications. With PCOS and insulin resistance, right? Of course, you'll lose some weight. So overall, people feel better, but it may not always be covered by insurance for that indication.
Okay, Dr. Peggy, you spent the whole episode telling us how safe it is, but now you just said the FDA didn't approve it. So why wouldn't the FDA approve something if it's not safe?
So, I mean, they've approved it for so many other indications, right? As clinicians, some of us do use it and we've seen good outcomes, but I haven't seen any recent studies saying, hey, they did this on PCOS with these medications and they've labeled it for that. So sometimes some medications have an off label use, right? We know that for PCOS, we keep telling them, hey, you have to lose weight. That's why we put them on metformin sometimes, right? But these are medications that can help them lose weight, help with their other metabolic issues, and make them feel better. I'm hoping that maybe eventually we'll have an indication from the FDA saying, hey, we can use this for PCOS because it'll benefit a lot of women. Unfortunately, I haven't seen it yet.
Okay. Well, speaking about women, Aisha said, look, I've heard about the cancer rumors, Ozempic face, and starting doses too high. What should I talk to my provider about if I decide to go this direction? What should I talk to them about?
So, Aisha, these medications, they are great, right? But you have to keep in mind with every medication, there are some side effects, okay? But before you start any of these medications, we have things we call contraindications. So, if you've had um, we call something pancreatitis, where your pancreas has been inflamed before, you may not be a good candidate for these medications. Or we have a certain type of thyroid cancer. It's called medullary thyroid cancer. And it is specific, it's medullary, because there are other types of thyroid cancers, right? But we know that people with a medullary thyroid cancer, or there's another syndrome, the men 2 syndrome, those people, we do not use these medications in them. So your provider will ask you about that. Hey, have you had pancreatitis before? Do you have a history of medullary, either personal or family? In those scenarios, unfortunately, it is not a good idea to be on these medications. Um, but if there's no contraindication, then yes, they are safe. Ozempic face is interesting because recently I saw something about Ozempic foot. But I think if you lose a lot of weight, right? If you've gone from 250 pounds and you did lose weight drastically, yes, your face will look a little bit thinner, right? It's not necessarily that it's Ozempic that's giving you that face, right? You've lost weight. So if you had a bypass surgery, your face, you'd lose weight and that's it. So I, unfortunately, Ozempic has had a pretty bad rap, right? But I think overall it's a great medication if used correctly and safely. Start slowly, build up. Don't rush through the medication. Oh, my tummy hurts, but hey, I want to keep losing weight, so I'm going to keep injecting. You're going to be in trouble. Or I'm throwing up, I don't feel good, but let me keep giving Ozempic. No. So just remember, it has to be done safely. Titrate, it has to be adjusted slowly but safely so that people feel well on the medication.
Hmm. Okay, now we're into our lightning round. So, what's one myth you wish people like Steve would stop believing today?
I think I want people to stop believing that it's only for weight. It's much more than weight. They're great medications. It's not just, oh, I want to lose weight. I had someone say, oh, I just want to lose 10 pounds for the summer. Can I? No, that's not what this
Mhm.
is about. Okay. The studies have been done that have shown benefit for your heart, for your kidneys, for your diabetes control. So they're more than the weight, right? Some types of the GLP-1s, like something called Trulicity, it's a great medication. You may not lose as much weight as you want. You might lose a few pounds, but it has a good cardiovascular benefit. It will help improve your A1C. People feel better. So yes, it's not just for weight. It does much more. And even for your mental well being, people have said their moods have improved. So, the myth that I want us to go away with, stop believing it's not just a weight loss shot. Actually, I have another myth that, um, and it's not, people shouldn't feel bad that they're on these medications. It's not the easy way out, right? You don't need to feel embarrassed that you'll be hiding it, that, oh no, I don't want anyone to know that I used this. They have good benefits, right? People have tried on their own. I know people personally who have made dietary changes. They go into the gym and they've only lost 2 or 3 pounds. Sometimes your body just needs that boost. So there is no shame in it. They are great medications. They work, right? For the most part, if you're doing all the right stuff, it is a helpful tool for you. It shouldn't be, oh, I'm gonna do it by myself. And no, I don't want to cheat. I feel like I'm cheating. You're not cheating anyone. You're actually doing yourself a favor, right? As long as you're using it safely, I think they're beneficial and there's no need to feel any shame.
Yeah, such a great point. And I think just these even being in existence has created so many more conversations around the topic. Because, like you
Yes.
said, sometimes people they have tried so many things, and I mentioned all these things Steve has on his plate, right?
Hmm.
So it's challenging to also come home and do all that. Even as clinicians, we're spending 12, 24 hours. Our pharmacist friends work 7 days straight,
Wow.
sometimes two
Wow.
weeks on, 2 weeks off, right? And then you want to come home and take care of yourself. I just wrapped an
Exactly.
episode. I just wrapped an episode with Janine Huff, who talked to me about compassion fatigue, a nurse anesthesiologist, and she
Wow.
had to take a sabbatical because she went through that severe burnout, losing infertility issues, divorce,
Mhm.
suicide rates. It's real, right?
Wow. Yes.
And so
Yes.
we know people have tried, and just having these conversations, having these options there, people have lost hope. And now they see, oh, my
Yes.
body actually can do something.
Absolutely. Exactly. Right. And I think it boosts people's confidence. Of course, I mean, whether you're 250 or 150, hopefully you still have your confidence. But I've had people come into clinic and their confidence, like they just tell you, I'm happier. I can do more with my children. I'm not as tired. I feel good. I can fit in the size. It does have its benefits. And I think there's definitely no shame in it. They're great as long as they're used safely. So I'm an advocate for these myths.
Hi, I'm Alicia from the Melanin Initiative podcast. Our mission is twofold. One, to simplify complex health information so you feel empowered to ask questions, educated on how to manage your health, and confident to navigate the healthcare system. And two, to elevate the expertise of nurses, spotlight the diverse career opportunities within the healthcare industry, and inform our peers how to leverage their expertise as clinicians and entrepreneurs. In less than 2 years, we've grown to over 50,000 views and 1,000 downloads, with an international audience spanning the US, Canada, the UK, Australia, and more. Our engaged listeners are professionals, entrepreneurs aged 25 to 44 who value authentic, impactful content. Want to connect with this dynamic audience? Advertise with us. Send in your 1-minute video ad and let's amplify your brand. Email tmi.melanin@gmail.com for rates and details. Let's work together.
And it's so good to hear you say that too, especially as an endocrinologist. And even in healthcare, a lot of us have been on the bandwagon. Even Alicia just shared with us that she got out of the pre-diabetic range. Like,
Yay!
she's so happy
Exactly.
about
Yes. 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 So that
it.
is great.
So what's the biggest thing anyone listening should advocate for before getting their first injection?
So you want to know, I keep saying we should all read, right? I feel like you always want to know what you're getting yourself into. These are great, but before you start, you want, because there are different types of medications. What am I going for? Um am I using this? Hey, yes, I'm overweight, I'm obese. We're going for weight loss. Some will give you more weight loss benefits, right? I have some people have a phobia for needles. Do you want to do once a week? Do you want to do once a day? So know what you, because some people, I have a patient who just is so scared of needles. He wants someone to do it for him all the time. He just can't do it, right? So if I put him on a daily injection, he might not do it, right? So once a week is an option there. Side effect profile. What am I getting myself into? Because yes, although they're safe, you might have some nausea with it. I have some people who just say, I feel queasy with these medications. Know that, hey, this is a possibility, and that's why we're starting at a low dose. Um, if you're throwing up, right, you use it and you're throwing up, maybe not a good idea to keep using these medications. So know that yes, they're great, they're safe, they're helpful, but there are side effects to them, right? Nausea is one of the main ones. Some people end up with constipation. I've had people with pretty bad constipation. So just knowing what to look for is helpful. That, hey, okay, maybe let me increase my fiber. I might have to start taking Metamucil so I don't wait till, oh gosh, I haven't gone in a week. No. I have this funny scenario. One of my patients, she couldn't even sit on the chair because she had been constipated for days and it was so uncomfortable, right? So you want to be proactive. So know what you're going in for. Know that yes, these are some of the side effects, so that you know that okay, this nausea is just not the simple queasiness my doctor said. This is severe. I feel sick. Maybe this is not the right medication for me. So we need to also do our research and know what we're getting ourselves into.
Wonderful. And in terms of research, where can someone start? They've heard the episode. Now they want to go do their research. What are some resources you can point out?
So what I like about these medications, the companies themselves have a lot of information on their websites, right? So if you typed in Mounjaro or you go to Lilly, the company's Lilly, right? Manjaro, they have a lot of patient information available. If you go to Ozempic, the Ozempic. So even just typing them in, don't just, no offense to WebMD and people's thoughts, but go to the actual company. Like if you went to Ozempic itself, they have data on there. Other medical literature. So something like the Mayo Clinic, Cleveland Clinic, all those big institutes also have some information on these medications. The Endocrine Society, the ADA, which is American Diabetes Association, also has some good resources too. But Endocrine Society, then we have a clinical something called AACE is also a good resource. So there is a lot of information out there with regards to these meds. So just make sure you're finding the right ones and not just hearsay on TikTok. TikTok has some good stuff, but don't get all your information from there.
Well, you certainly gave us what we needed today, and we know everyone's going to share this information with their network. Where can they connect with you if they want to reach out?
So I'm still I still work at Mary Washington Hospital, so I'm still there. And we have a hospital in Stafford, Virginia, where I'm still available. I am on LinkedIn as well. You can find me on there. You might find me on other social media, but yes, LinkedIn and then the hospital network.
Wonderful. And I just want to shout out my dad again. This is your second episode. He's the reason that he's your patient, and at least for now. And he's responsible for this introduction and bringing you on to the podcast.
Yes,
We can talk about some really important topics. And like I said at the top of the show, this is your second time on. The first time you talked to us about thyroid, the difference between hyper and hypo. And so we'll put those links in the description box. Anything else you want the audience to know before we sign off?
Advocate for yourself. Ask questions, okay? If you're not sure, ask. Don't go to your physician feeling shy or, I don't know what they'll think about me, or maybe this is a silly question. I tell people, hey, you're paying, this is not free. So ask if you don't understand why and sometimes some of the questions true. Some of us will be thinking, maybe it, it's definitely not the medication. That's fine. You don't know. So you are the client, you are the patient. You have to advocate for yourself. Ask questions. If you're not sure, read. So I think that's the advice I'd give, ask, read, ask and read. It does help a lot.
So now when it comes to our peers, right, you shared that you're stepping into your soft era. And people are watching this who are aspiring to be in your shoes. They are working on getting that residency in endocrinology as we speak.
Yes.
Now, knowing what you know, knowing the decisions you're faced with at this moment, what words of wisdom do you have for that person who's applying for that residency right now?
Oh gosh, I think residency is great but tough. You will get through it, right? But I would say apply yourself. Hard work pays. It is one of those things. It's nothing good comes easy, right? You have to put in the effort. You want to. There's some people who try to be slick and sly. They don't want to see the patients. They want to, but the more you see, the more you read, the more you know, the better you become, right? And um this is a give and take scenario. I don't want, yes, you want to get into residency. It's not just because, oh, I want to make money or this. This is a calling. We're here to serve people, make a difference in people's lives. So having that at the back of your mind will take you far, right? There's so many of us who will get into residency, but not everybody's going to be a great physician or a great doctor or nurse practitioner. You have to put in the work and you have to give your all too. So it definitely isn't easy, but I definitely think it's worth it. As I said, endocrinology is great. It's good specialty, good lifestyle, and it makes a huge difference in the lives of the patients. So definitely consider endocrinology too.
Okay, so they put in the hard work. They've finished their residency. They might have even done a fellowship. Now they're stepping into the dream, right?
Yes.
And you're taking a break, right? So what advice can you give them? They already know about how to take the best care of their patient, how to work hard. What about for them?
Oh gosh, take care of yourself. Burnout is real. there's a lot. The demands are high, depending on where you decide to work, which hospital system, patients, there's this thing called my chart messages or patient messages. Sometimes those are a lot. Insurance has demands. So you have to prioritize, know what you're getting yourself into. Know that, okay, hey, maybe I'm comfortable seeing 15 a day. Do not, if they're giving you pressure that, hey, see 20, know your limits, because you will burn out and then you cannot give your best to your patients, right? You'll be sick, they won't have you, and at the end, both of you lose. So know that this is a tough, medicine is difficult, right? Any form of medicine is tough, but you have to know that, hey, set some priorities, things that can make your life easier. Maybe this EMR, which is the medical records, there's a dot phrase, there's a something to make your life easier, right? But if you're gonna now be typing each note, if you can dictate, do that. You have to find simpler ways. Your notes, you want to keep them concise, to the point. We don't want to beat about the bush. Oh, and 2 weeks ago he didn't eat this. No, get to the point of it. You want to get to the point, bill well, right? Correct billing, so that you're not just, so at least if it's a RVU based system, you're being paid for the work you're doing. You don't want to write this long note and then you bill very low. So knowing how to bill or code is one good thing, okay? But smart ways that you can ease the stress on you. And if you need a break, take a break. I mean, I'm not encouraging everybody to go for soft life stuff, but you don't want a job that's going to let you work, every day, and your weekends you're on call. They're calling you, you're not sleeping. You will burn out, right? So we need to take better care of ourselves. We need to eat well. We need to sleep, and it's okay to take a break. Hey, oh, this person didn't show up for work. Who wants to pick up this shift? Don't raise your hand all the time. Because it adds up. The next thing you know, you'll be 40 and you're exhausted, and then so I think that's something that I've learned too, that we need to take good care of ourselves, take a break, enjoy your family, enjoy you. And I think that goes a long way to make us more productive too.
Yeah. And you're taking that advice, Dr. Peggy?
Yes, I am. That's part of the reason I have decided to take some time off and breathe and enjoy my husband and my children and take things slow for a bit. Definitely, I love endocrinology. This is something I will keep doing, but it's time to also take a little bit, take more better care of myself. I'm gonna go to Ghana, so I'm excited about that. Yeah.
Wonderful. Well, we're so happy. Thank you for sharing your words of wisdom, right? Those are real words based off real life experience. And you speak for all of us when you talk about how important it is to take care of ourselves in a profession where our job is to take care of other people first,
Mm-hmm.
first, second, and last. And then when you come home and have those same responsibilities, it's a challenge. It is a
It
real
is.
challenge. And not only do we need to take that advice for ourselves, we need to create space like that for each other. I just
I
saw you pick
agree.
up 3 extra shifts. Are you sure you want to do that? There are other people who can do this. You don't have to be. So I think we need to do that both ways. And we just are so happy for you stepping into this soft life. Like I said before, I hope it changes the trajectory of your future. And in fact, it changes how you see yourself and what you do next.
And I appreciate that so much. I'm actually thankful for your dad, and I'm happy that he, introduced me to you, and I'm so appreciative. I've enjoyed these podcasts, so thank you once again.
Yeah, we would love to see you join the podcast family. I don't know any
I would love
endocrinologists
to.
out here. And it's a creative space. It's totally different than what you do on your day to day. And I think when you have that balance of doing those two things, it reinvigorates you. It brings joy back to the clinic, and it helps you do whatever you want to do on the other side.
I,
That
I
art, the
agree.
art part of our practice, sometimes it isn't there because we're so,
Yes,
the regimen and the checking off the boxes and documentation. And this is the art part. There's really no rules. Like it's no
I
rules.
love it.
Yeah.
I am. I think I'll add this to my soft girl era.
Wonderful. Well, we thank you all for watching. You can email us your questions and show ideas at tmi.melanin@gmail.com. If you haven't already, continue to leave us a comment, subscribe, give us a thumbs up. We know most of you are watching us on Apple, and then the rest of you are watching us on Spotify. please kindly give us 5 stars there. It helps the algorithm to see that this information is important so that when people like you look for topics like this, we'll show up higher in the search results. At the time of this recording, we release new videos every Sunday at noon Eastern on YouTube, LinkedIn, and Facebook, and we drop the audio at 5 a.m. so all our night shift friends can be the first to get something and not the last. We thank you all for watching. We'll see you next time.